Okay, can you see the slideshow?
Yes.
Okay, Ovarian Cancer by Ritu and Rani Haslia.
So just a brief overview of ovarian cancer. It's the abnormal growth of cells in the ovaries, which is the female reproductive structure that produces eggs. 1 in 70 women will develop ovarian cancer in their lifetime. Some of the most common risk factors for ovarian cancer include older age, typically above 50, early menarche, late menopause, a family history of ovarian cancer, or a mutation in the BRCA1 or BRCA2 gene in a first-degree relative, and obesity. And ovarian cancer is difficult to detect in the early stages because the symptoms are so nonspecific. So it's not detected until it's spread to other areas. Therefore, it is the leading cause of death from female reproductive cancers. So we conducted a review of current research on ovarian cancer.
The first article that we reviewed is from the Journal of Hospice and Palliative Nursing, and it's called The Exploration of Families' Experiences Caring for Loved Ones with Advanced Ovarian Cancer. So the objective of this study was to explore the adversities faced by family members caring for their loved ones that were in advanced stages of ovarian cancer. And the participants of this study were 13 primary family caregivers that were caring for their loved ones that had ovarian cancer. So the results of this study show that the caregivers in the study faced 4 significant challenges. And these challenges included confronting the initial diagnosis and approaching changes in physical status, acknowledging that there is a turning point, and facing decline and death. Their caregivers also talked about their difficulties in accessing healthcare information and navigating the healthcare system, which caused them to have increased stress. The nursing implications of this study are that it is essential that nurses do not solely focus on patient-centered care, and that nurses are more holistic in their approach in order to acknowledge the experiences of family caregivers. And this evidence-based practice can be applied to nursing through empathizing with the family, using therapeutic communication, and providing the family with resources, since the family does play an important role in promoting and maintaining the health of the loved one. And they also provide physical and emotional support for them as well. And so it's important to meet the family's needs too. And the study shows that using all these factors in nursing care can make a positive impact on patient and family experiences. And it can also decrease stress for the caregivers. So the second article that we reviewed is called Bisphenol A Induces Ovarian Cancer Cell Proliferation and Metastasis Through Estrogen Receptor Alpha Pathways. And the objective of this study was to investigate the effects of bisphenol A, which is also called BPA, on progression of ovarian cancer. In this study, ovarian cancer cells were treated by a combination of bisphenol A and estrogen receptor inhibitors. So the results were that long-term exposure to low concentrations of bisphenol A stimulated proliferation of ovarian cancer cells. So this caused metastasis of ovarian cancer cells, which occurred through the estrogen receptor signaling pathways. And the nursing implications. So as nurses, we should caution patients with ovarian cancer against the use of polycarbonate plastics that contain bisphenol A. So BPA is a normal household product, and therefore as a nurse, we need to inform our patients about trying to avoid these products to prevent further metastasis of the cancer. Educating patients about alternative items that are available and about the harmful effects of BPA is also important, and it's a form of prevention through behavior modification. So on the right, there's a picture that shows objects or items that BPA can be in, which is canned foods, toiletries, feminine hygiene products, items packaged in plastic containers, household electronics, thermal printer receipts, and dental filling sealants and sports equipment. So on this slide, there's pictures of labels that indicate BPA-free products, which you need to educate your patients to look at these labels. So the third article that we reviewed It's called Intraperitoneal Chemotherapy, the lived experiences of Taiwanese patients with ovarian cancer. And this article is from the Clinical Journal of Oncology Nursing. So the objective of this study was to explore the experiences of patients that were diagnosed with ovarian cancer who had received at least one cycle of intraperitoneal chemotherapy. So the participants in this study were 9 women with ovarian cancer and an average age of 50.8 years. So since intraperitoneal chemotherapy is now like a standard treatment for ovarian cancer, this study wanted to identify how these patients felt while going through this chemotherapy. And the themes that they identified through interviewing them were anxiety, specific symptoms, physical and psychological issues, isolation, adverse reaction, and support throughout the treatment for ovarian cancer. And the results of this study showed that a majority of patients undergoing intraperitoneal chemotherapy for ovarian cancer experienced severe psychological, physical issues, psychological discomfort, and worrying about illness. This can be improved through holistic nursing care. And so the nursing implications of the study are that patients do need further education about side effects of intraperitoneal chemotherapy treatment for ovarian cancer. And providing holistic care to reduce complications with illness can be incorporated into nursing practice through educating them about these side effects. And nurses play a significant role in managing adverse effects, encouraging social support, and decreasing psychosocial distress during treatment. And since being diagnosed with ovarian cancer is already very stressful, being fully educated about treatment and what physical issues it may cause can help the patient know what to expect. And since the patients in this study reported reduced physical and psychosocial distress through holistic care, this means that nurses could improve care by looking at the patient as a whole person in order to anticipate like their emotional, physical, social, and spiritual needs.
So our fourth article investigates whether HE4 tumor marker measurements during first-line chemotherapy can predict a response to treatment among ovarian cancer patients. So each of the 90 patients in this study underwent HE4 and CA-125 measurements at the time they were diagnosed with ovarian cancer and throughout different points in their treatment. So the researchers found that a reduction of HE4 levels after treatment confirmed that HE4 levels can predict treatment response in ovarian cancer patients. So the results of the study have many implications to nursing practice. It's important to educate the patient about tumor markers and how they can predict responsiveness to treatment and what kind of treatment the cancer may be responding to. So this research helps nurses provide reliable information to the patient about their likelihood of survival. So the HE4 tumor marker is important in nursing practice because nursing interventions can be based on the predicted course and likely outcome of their cancer, such as if there is no likelihood of survival since the cancer isn't responding well to treatment and palliative therapy is needed, versus if the cancer is responding well to aggressive chemotherapy. So interventions can be based on this. Okay, so our fifth article is from the Journal of Obstetric and Gynecologic Neonatal Nursing. So the researchers performed a cross-sectional study to investigate problems during various treatment points among women with stage 1 to stage 4 ovarian cancer. Some of the issues that the researchers looked at included physical, psychosocial, pain, marital, medical interaction, social support, and optimism. And this study found that these physical and psychosocial issues were greatest during the beginning of treatment and decreased throughout treatment. They also found that women with more social support and optimism had fewer issues over time. Also, women who were able to pay for basic treatment-related expenses had fewer issues related to pain and their mental health. So there's many nursing implications of this study. It's essential for nurses to address problems across all domains before, throughout, and after the treatment. Because nurses need to be aware that all patients don't come from the same background. Therefore, ovarian cancer treatment places greater strain on those with less social and financial support. So it's important for nurses to advocate for health equity. It's also very essential for nurses to remember that they are the patient's advocate. Therefore, they should appropriately refer patients to social workers and should perform routine assessments of any issues that the patient is reporting. So our first audience engagement question is, measurement of which tumor marker has been shown to predict response to treatment among ovarian cancer patients? And the answer is C, HE4, which has been seen to predict the course of ovarian cancer and its responsiveness to treatment.
The next audience engagement question is, which of the following products contains bisphenol A, which is associated with ovarian cancer metastasis? Select all that apply. The answers are A, B, D, and E. So canned food, toiletries, feminine hygiene products, and plastic water bottles. All these products contain bisphenol A except for answer choice C. Items packaged in glass containers do not contain BPA, while items packaged in plastic containers may contain BPA. Okay, that's it.
Thank you for listening to our presentation.